Welcome to Lager Lectures Online, part of our series of digital lectures presented by the McMaster Alumni Association. These in-person and online lectures are named after McMaster graduate Albert Abram Lager, a great believer in the value of lifelong education. He created the Albert Abram Lager Foundation, which supports several organizations in their efforts, including the McMaster Alumni Association.
Unstructured search, and these algorithms were designed to suit. All right, hello and welcome. My name is Jillian Halladay, and I'm from the Department of Health Research Methods, Evidence, and Impact at McMaster. Thank you for joining us for this Lager lecture online. You'll have the opportunity to ask questions by clicking on the Q&A button at the end of my presentation, and I'll answer as many as possible in the allotted time at the end. I also want to acknowledge that Dr. Michael Amlung was unable to come this evening, so I will be presenting on his behalf. So the slides that I have today are a combination of his slides, my slides, and work that we've done together. And I'll put up his contact information as well as mine at the end of the presentation. All right, so today I'm going to be taking you through a discussion on exploring cannabis use and mental health in Canada's post-legalization era. And I first want to begin by acknowledging that we meet on the traditional territories of the Mississauga and the Haudenosaunee Nations within the lands protected by the Dish with One Spoon Wampum Agreement. Neither Dr. Amlung or I have any conflicts of interest to disclose. And before I dive deep into what we're going to talk about today, I first want to give you a brief background on my training and where I come from in terms of mental health and substance use. So I did my Bachelor's of Science in Nursing at McMaster University, and for the past 4.5 years, I've been working on the Child and Youth Mental Health Inpatient Unit at McMaster Children's Hospital. I also did some substance use counseling with post-secondary students at McMaster as part of this program called Arrive and Thrive with Student Affairs a couple years back. I also did a master's in clinical epidemiology where I focused on looking at cannabis and mental health in the Canadian population and how it's changed over time. And then now I'm in the midst of my Ph.D. in health research methodology, where I'm focusing on the co-occurrence of mental health and substance use, mainly cannabis and alcohol, and mainly among youth. So I do take a harm reduction perspective in that I believe that abstinence is not the only option. I also take a concurrent disorders lens in that I acknowledge that cannabis and substance use commonly co-occur. And as a healthcare professional, I believe that this co-occurrence is something we should be ruling out as opposed to ruling in. I also want to acknowledge my committee members and senior mentors. So Dr. Kathy Georgiadis from the Offord Center for Child Studies is my primary supervisor. Dr. Michael Amlung, who is unable to come tonight, is also on my committee, alongside Dr. Catherine Munn and Dr. James McKillop, who have influenced my work and helped me with my knowledge that I'm going to be sharing with you today. So I'm going to talk a lot about a lot of different things, but not in too much depth, as cannabis is quite complicated, but I will put up some resources at the end for further learning. And again, we'll have that Q&A period and you'll have our contact information. But first, I think it's important to quickly discuss some key milestones in cannabis policy in Canada. So discussions about controlling cannabis date back to the 1890s in Canada. And in about 1920s, that's when cannabis became illegal. In the 70s, the government established a commission to look into alternative strategies for addressing cannabis use. And that commission recommended decriminalizing cannabis at that time, but that was ignored during that time period. Fast forward to 2001, and that's when medicinal cannabis became legal. And then there were various changes to those regulations over the years. Now, it's important to note that medicinal cannabis is something that's authorized, it's not prescribed. So it's quite different and distinct from your typical prescription medications. So it isn't an FDA-approved drug. And when you do access medicinal cannabis, it's not like you have a specific biochemical formulation that you're consistently getting every time. And then last year in October of 2018, we had national legalization of recreational cannabis use, and we have had various changes to that over the past 1.5 years with recent national legalization of edibles as well. Now, even though this is a federal law, the actual regulations are governed at the provincial and the territorial level. So even within Canada, we have quite distinct differences in policies across provinces and territories. So this can make it a bit complicated, but also exciting to explore the effects of legalization and different policies. Now, during the past 2 decades, we've had dramatic changes in policy, but we've also had changes in public perception. So we've had a dramatic increase in the social acceptability of using cannabis, and we've had a dramatic reduction in the perceived risk associated with using cannabis, both occasionally and regularly. So before legalization, the Canadian population had one of the highest rates of cannabis use in the world. For Canadian youth, they actually report they had the highest rates of youth use in the developed world. So we had quite high cannabis use prior to legalization. Now, Statistics Canada has done this national cannabis survey every quarter since prior to legalization. That's looked at things like prevalence of cannabis use to monitor it over time. So this graph right here in the dark green is showing pre-legalization, the prevalence of past 3 months cannabis use, and the lighter green is the third quarter in 2019 after legalization. So as you can see across these age groups, that there's been a slight trend upwards in the prevalence of cannabis use post-legalization. However, it is important to note that every quarter this is looking a little bit different. So we don't know right now for sure if there has been a significant increase in cannabis use, and if so, for what age groups and what type. Is it experimental use? Is it regular use? So that's still being monitored, and hopefully we have some answers to that soon. I also want to draw your attention to these 2 age groups here. So the 15 to 24 and the 25 to 34. So typically when we're talking about cannabis use, you might hear the terms emerging adulthood or adolescence and emerging adulthood. So adolescence is typically 12 years old to 18 years old, and emerging adulthood is that period of time transitioning between adolescence and young adulthood. So that's usually 18 to 29 or 30 years of age. And that age period consistently reports 2 to 3 times higher prevalence rates of cannabis use than the rest of the population. That age period or that age group also tends to experience more problems from their use, potentially due to kind of their developmental period in terms of brain development, in terms of social and emotional, cognitive development, needing to do well in school, to get a job, etc. Now, there is a study right now at the Peter Boris Center for Addictions Research associated with McMaster that is trying to answer some of these questions around the impact of legalization. So it is following individuals pre-post legalization to hopefully answer some of these questions. So stay tuned for results from that study. So that's kind of some key milestones and who and how many people are using cannabis, but what is cannabis? So cannabis is an overarching term for a lot of different things. There's about 500 ingredients in cannabis, 100 of which are cannabinoids, and 2 we talk about and we've researched in the context of effects on the brain. And these are THC and CBD. So THC is that part of cannabis that's responsible for the psychoactive high, whereas CBD doesn't have any psychoactive properties, mitigates or offsets some of the effects of THC, and might in itself have some therapeutic properties that are being explored. Now, your typical recreational cannabis product is usually high in THC and low in CBD. And prior to legalization, we were seeing a dramatic increase in the potency or the average amount of THC in recreational cannabis products and a dramatic reduction in the amount of CBD. So we had this increasingly potent product over time. Now, it's also important to note these are 2 of 500 different ingredients. So we're still uncertain about how these 2 cannabinoids interact with those other ingredients, and if there are other ingredients as well that are playing a key role in and of themselves. So it's quite a complicated thing. The other thing to keep in mind with that is you might have heard the terms cannabis sativa or indica or strains or cultivars. These are really not helpful when we're talking about cannabis use because it's so complicated and we have those 500 ingredients. There aren't consistent effects of cannabis sativa or indica on individuals. So we really need to start focusing on the biochemistry of cannabis as opposed to these strains or cultivars. And there is research that's going on right now that's trying to typologize cannabis in the complete biochemical profile, and it's called chemovar mapping, but it's in early stages right now. But it is important to think about the full biochemical makeup and not just these strains. So we've got lots of ingredients that can come in lots of different combinations, and we also have a lot of different ways to use cannabis. So you can smoke cannabis, vape cannabis, consume via edibles, there's topicals, there's extracts and resins, some of which can be super high potency THC, upwards of 80%. And we do know that the way you consume cannabis impacts how high you get, how long you stay high, and how quickly you get high. But we don't know right now about how these different methods of delivery impact people in the longer term, and if there are differences in the longer term. So overall, it's quite complicated, but when you hear people talk about the high of cannabis, that's usually referring to the effects of THC. And this includes altered and enhanced senses, altered sense of time, changes in mood, impairments in body movement and coordination, difficulty thinking and problem solving, impaired memory, and in high doses can lead to hallucinations, delusions, and symptoms of psychosis. But where does cannabis actually act in the brain? So we have our own natural endocannabinoid systems that are widespread throughout the body, but in the brain, it's found particularly in areas associated with motivation, emotional learning, learning and memory, and emotionality and higher cognitive functioning. This natural endocannabinoid system also plays a key role in how the brain responds to stress, the reward and addiction pathways in the brain, as well as how the brain develops. So we have our own natural endocannabinoid system, so we also have our own natural cannabinoids that act on this system. But our natural system is really tightly regulated, where our brain kind of creates these cannabinoids and destroys them as we need them and don't need them. So when we have an external cannabinoid like THC coming into this system, it binds much stronger and lasts longer, potentially overstimulating these pathways in the brain and potentially resulting in structural and functional changes. The other important thing to keep in mind is that this system develops and acts differently in biological males compared to biological females, and there's emerging research suggesting that cannabis acts differently in females versus males. Now, you may have heard about the concerns around youth cannabis use, and this typically comes in because the brain is still developing until about mid-20s or 25 years of age. So the adolescent brain is kind of like being in a car that has a gas pedal without a brake. So the earlier part of the brain to develop is the limbic system, and this is the emotional reward center of the brain. The last part of the brain to develop is the prefrontal cortex, which is involved in decision-making, planning, higher order thinking. So an adolescent has this urge to take risks, to be impulsive, to have an immediate coping strategy, to feel good right now, without that ability to stop and think about how it might be impacting them tomorrow, next week, next year, or down the line. So this makes youth particularly vulnerable to using cannabis in the first place, but also because the endocannabinoid system plays such a key role in how the brain develops, cannabis might also negatively affect how the brain develops, although research is still ongoing in that respect. There are some other long-term effects of cannabis. So cannabis does have addictive potential. So about 3 in 10 individuals who use cannabis develop a cannabis use disorder. That increases about 4 to 7 times if an individual starts using cannabis when they're under 18. There's also some risks for lung health concerns. There's also, again, that risk of impaired brain development and some potential cognitive impairments as well. So there have been studies that have shown that individuals who use cannabis have reduced attention, poorer short-term memory, and poorer learning. In youth that use cannabis, they're more likely to drop out of school, to not do as well in school, to get poorer grades. And although there's been some studies in adults that have shown that after a period of sustained abstinence, that some of these cognitive effects appear to be reversible, we're not sure if that's the case with youth use, given their brains are still developing. And also, kind of regardless of if they're reversible or not, in that moment, a youth may experience impairment, which may impact their ability to learn and do well in school, which then kind of has trickle-down effects into adulthood. And there's also that increased risk of mental health concerns that I'm going to dive a little bit deeper into. So the likelihood of having any substance use problem is at least doubled among those with another mental health disorder. When we talk specifically about cannabis use, this appears to be more disorder specific in terms of what direction it is, how strong this association is, and how much evidence we have right now to support it. So the strongest evidence we have right now is cannabis preceding the onset or the development of psychosis or psychotic disorders, especially when there are particular genetic risk factors. There's also a fair amount of evidence supporting cannabis preceding the onset or the worsening of depression or suicidal thoughts or behaviors. With anxiety, it's a bit more mixed, and it seems to be anxiety disorder specific. So for example, social anxiety disorder usually occurs first, followed by cannabis, potentially for coping purposes, but then those individuals are more likely to later experience a cannabis use disorder. Similarly with externalizing or behavioral disorders, this is like ADHD, oppositional defiant disorder, and conduct disorder. Those typically are diagnosed in childhood, so cannabis occurs afterwards, but again, they seem to be consistently co-occurring. However, this is quite a complicated relationship impacted by genetics. How early does an individual start using cannabis? How potent is the product that they're using? And how frequently are they using? So right now, we don't have a clear-cut answer as to whether cannabis is causing mental health problems, is a consequence of mental health problems, or is correlated with mental health problems. But regardless of kind of which one is coming first, cannabis and mental health concerns consistently co-occur, and there's emerging evidence suggesting that this co-occurrence may be related to more problems in terms of severity and complexity of mental health concerns, and if and how an individual responds to treatment. However, in terms of co-occurring cannabis use that may not be at the level of a cannabis use disorder, we definitely have limited research on this, especially with youth use. So we do have a study that's going on right now at McMaster Children's Hospital called the CAMP study, which stands for Cannabis, Alcohol, Mental Health, and Patterns of Service Use, where we're looking to answer this question to see if cannabis use is related to severity, complexity, and treatment use, or service use among youth who are admitted to the hospital for mental health concerns. So hopefully we can start to answer some of these questions. Now, it's also important to note that not all cannabis use results in problems, but there are some characteristics that make people more likely to experience problems. So starting use younger, having higher potency use, using more frequently, if you have a personal or a family history of a mental health or a substance use problem, all of that kind of increases your likelihood of experiencing problems from use. You can also experience problems from use without being at the level of a cannabis use disorder. And so individuals that do experience problems from use rarely seek out help. So there is an issue in terms of getting people to seek out help when they need it. However, the evidence for how to best effectively help right now is also fairly limited. So the best available evidence right now suggests that we need to be assessing and monitoring for substance use problems alongside mental health concerns. If an individual is using cannabis, there's some evidence for the effectiveness of brief interventions for cannabis use. So a brief intervention is typically something that's 1 to 2 sessions in duration using motivational interviewing approach. A group of us at McMaster did do a systematic review on the effectiveness of brief interventions for cannabis use among emerging adults. And although there were some promising findings, there's definitely areas for further research for us to look at specific populations, especially those with co-occurring cannabis and mental health concerns. Also, those that are experiencing more problems or are ready to make larger changes might need longer-term treatment, and the best available evidence is cognitive behavioral therapy or motivational enhancement therapy, and if those aren't working, adding in contingency management. Right now, there is no pharmaceutical or pharmacological interventions for the treatment of cannabis use disorder, although there are a number that are being explored. I also do want to touch on medicinal cannabis and mental health. So many Canadians use medicinal cannabis for mental health conditions, and a lot of them do report that they feel like they are experiencing clinical benefits and are able to reduce their use of other medications. Right now, we don't have the scientific evidence to support that. We don't have tons of evidence right now. There is some for medicinal cannabis potentially being helpful in PTSD and anxiety, but actually some evidence of ineffectiveness for depressive disorders. And right now, the guidelines for healthcare professionals is recommending against authorizing medicinal cannabis use if an individual has a history of a severe mental health or substance use concern, or for those under age 25. However, most of our evidence right now on medicinal cannabis use comes from looking at pharmaceutical cannabinoids. So there are a number of FDA-approved medications that are based on either synthetic THC or kind of isolated CBD and THC, and that's what most of that science is based on, and that's not typically what you get if you are going and using medicinal cannabis, as again, we've got those 500 ingredients. So this absence of evidence is not necessarily evidence of absence of effectiveness. However, we have a lot more to go in terms of trying to figure out what combinations of ingredients are potentially helpful and for whom, and what combinations of ingredients are potentially harmful. So as you can probably guess from that, we've got a lot of unanswered questions. So we do have current priorities in terms of assessing what happened pre-post legalization, and we do have that study at McMaster that's hoping to answer that. We want more longer term studies, so looking longitudinally about effects over time, more studies with clinical samples on the treatment of cannabis use. So even though we did do that systematic review and found some evidence of benefit, again, there were definitely gaps in areas where we could improve further. And then also more evidence on medicinal effectiveness. Also, that should likely be a little bit easier now that it is legal, so that we can look at that a little bit further. So overall, cannabis refers to many different products with various combinations of ingredients and methods of delivery. Cannabis acts on areas of the brain involved in executive functioning, motivation, the stress response pathways in the brain, and in brain development. And cannabis and mental health concerns commonly co-occur, but the specifics of these relationships are complicated and still being explored. So after this, if you're interested in learning more, there are some great research summaries available through the Canadian Centre on Substance Use and Addiction website, as well as the Michael G. DeGroote Centre for Medicinal Cannabis Research. There's also some great public health resources like the Canada's Lower Risk Cannabis Use Guidelines, some cannabis talk kits that take a motivational interviewing approach to your conversations. A group of us at McMaster also did help create and consult on a practice guide for school mental health professionals on cannabis use through School Mental Health Ontario that's available online. There's also a course through McMaster University Continuing Education that was created in partnership with the Peter Boris Centre for Addictions Research and the Michael G. DeGroote Centre for Medicinal Cannabis Research. That's all available online, and there's 3 courses that you can take that are all great. So thank you very much. There's my contact info, Dr. Amlung's contact information, and also our Twitters if you want to connect with us after. So it's now time for a Q&A session. If you have a question, click on the Q&A button at the bottom of your screen, type in your question, and we'll try to answer as many questions in the allotted time. So an anonymous attendee said, what is the next step in cannabis research in terms of a study? So it's really complicated in terms of if we need to research both ends. So we need to be researching the medicinal effects, both in terms of physical health as well as potential mental health benefits. So there's kind of that field of research, also pain. So there's the potential medicinal effects. And then we also need to look more into the treatment, co-occurrence of problems, which one's coming first in terms of mental health concerns, and then if they need different treatment strategies, for example. Okay. So another attendee said, does McMaster do research with other psychedelics? Will this be a future focus? So I'm not exactly sure if McMaster does research on other psychedelics. I do know that U of T does have a research center on psychedelics. There's also a study out of BC that's looking at the effects of MDMA on PTSD. There are some looking at psilocybin and mental health concerns, but this is in fairly early stages right now of the potential benefits of psychedelics, but it is kind of an up-and-coming field, yeah. Okay, perhaps, so Kenny said perhaps not direct part of your research, but what are current evidence regarding cannabis use in geriatric populations? I'm mainly focused on youth, my research, so I'm not quite sure, although I do know that that is definitely a target of the medicinal effects of cannabis as well as recreational, as there does seem to be a little bit more of an increase in older population youth post-legalization. So we need to look a little bit more into why that is, and then is there a way to help this population as well, potentially with cannabis? So I know that that's a target for research, but I just don't know the answer to that one. Yeah. All right. Okay, so Kevin said, compared to smoking cigarettes, has research been done to determine delta? Example, is cannabis at least better for those wishing to quit? So I know there is research being done affiliated with McMaster on the impacts of smoking cannabis on lung health. It has been related to lung health concerns, especially with the recent vaping. Now, cigarettes are definitely very harmful for your lungs, and I'm pretty sure more harmful than cannabis. However, in terms of if it's better than to quit, that's, again, another area for research in terms of substitution. So can cannabis be a substitute? Should it be a substitute? But I think kind of our main hope is to prevent use in the first place. So I think we need more health prevention and health promotion efforts at the beginning. All right, so Elizabeth says adolescents are using cannabis. What is the safest way to use, ingest, or smoke? Yes, so this is where we're a bit stuck, because right now the Canada's lower risk guidelines does right now recommend that vaping is better potentially than smoking, and that edibles may be potentially healthier than smoking cannabis. However, given kind of the recent unfolding in terms of vaping and lung health concerns, a bit uncertain about that one. Also, the issue with edibles is, although it might be better for lung health because you're not smoking, it's more difficult to titrate, especially for adolescents. So with edibles, it takes a lot longer for you to feel high, and the high lasts a lot longer, so several hours. So a youth may use a little bit, not feel high, and then end up using a lot more, and then kind of over-ingest, over-consume, and end up being way more high than they wanted to for a way longer period of time. Whereas with smoking, you feel high within a couple minutes, and it lasts 1 to 2 hours. So again, it's kind of difficult in terms of lung health, potentially edibles, but also more difficult to titrate, and then some more kind of questions coming up around vaping recently. All right. So why is Alberta's cannabis use minimum age lower than others? So again, even though it's a federal law, each province is able to regulate use. I'm not exactly sure about Alberta specifically, but everybody does have the opportunity to change things like minimum age, because it is provincially and territorially regulated. There were lots of conversations about the minimum age. So at one point it should be 25 because of brain development, but then that's also still we still have the highest rates of youth use in the developed world, so what we're doing already isn't working. So it ended up being in alignment mainly with alcohol use, so when an individual is legally allowed to use alcohol, but it was definitely a very complicated and very tough call, and some places have even changed their minimum age over the past year. Mm-hmm. Okay. So we have, are there any benefits to using medicinal cannabis for treating personality disorders, or does this create more issues or problems? Some research shows that it minimizes violent and aggressive behavior, a better choice than alcohol. So with medicinal cannabis, again, right now, the best available evidence for that is for PTSD and anxiety, and definitely not as a first-line treatment at the moment. There are kind of there's research showing the co-occurrence of personality disorders in cannabis. Again, it's complicated in terms of which one's coming first. Is somebody coping and they're actually doing better with it? This is that kind of complex question, but when we have co-occurring cannabis use disorder or substance use disorders and other mental health disorders, it tends to be more complicated and more severe and more difficult to treat. So it's complicated again because we have these 500 ingredients. So your typical recreational cannabis product is commonly associated with problems. But again, that might not be what you use medicinally. You might use more of a CBD-based product or different, again, ingredients that act differently than what we've researched, because what we've researched is your typical high THC, low CBD product. All right, so Kenny says, as a paramedic, I often see nabilone prescriptions to the elderly. Are there any current studies looking at clinical benefits of cannabis in geriatrics? So yes, I know, again, this is definitely a field of, or an area of interest, again, because of the amount of opioid use among older populations, and we've seen a potential increase in use in this population. So field of interest, and that is ongoing right now. Okay. So Lynn says there are a lot of products emerging using CBD oil to treat a range of ailments such as arthritis. Can you comment on effectiveness of these products? So again, like I said, most of the research right now is on pharmaceutical cannabinoids, so not based on CBD oils. So a lot of kind of where we're at in terms of our discussions about cannabis, in terms of where our policy is at around cannabis, is way ahead of where our research is. So our research is trying to kind of come up to catch up to be able to inform questions like that. So hopefully now that we do have legalization, being able to use actual CBD oil as opposed to a pharmaceutical CBD or cannabis-based product can help inform those questions. So an anonymous attendee says, do you have any advice for regular cannabis users? So this is a great question. So again, like I said, not everybody experiences problems from their use. So it's important to kind of reflect on your own use and see if and how cannabis is benefiting you, if and how cannabis is potentially getting in the way of what you want to do. So looking at what is it doing for you, what do you not like about it, and is it getting in the way of you wanting to live in alignment with your values or your goals, for example. It can be helpful to see if you might be experiencing any of the negative effects from cannabis, or if you reduce your use, do you notice things differently? So again, kind of reflecting on your values and on how it may or may not be impacting you. If you do think that it's something that is impacting you in a way that you're not really enjoying right now, I do encourage you to reach out to a healthcare professional or to a mental health care professional to kind of talk about next steps. Again, we do have some evidence of treatment of cognitive behavioral therapy and motivational enhancement therapy being effective. So there are kind of options and ways to be able to reduce your use using evidence if that is something that you choose to do. Mm-hmm. Okay. So so Peter says, how are researchers elucidating the co-occurrence of mental health issues in cannabis use, i.e. which one comes first? Great question. So we do know that they're co-occurring. It's difficult because it depends on the age of onset for the mental health issues. So for behavioral disorders, those have their onset in childhood. So if we wanted to answer kind of the which one comes first question, we also have to kind of start following people when they're 6, 7 years old up until potentially when they're 30 years old to see what happens. So these can be kind of really long-term studies, for example. We can also ask people kind of when did you start using cannabis and look to see when were they diagnosed with mental health concerns, so we can do some chart reviews, for example. There is a big study going on right now in the States called the ABCD study that's following kids aged 9 for a number of years. I believe it's 10 or 20 years, and they're going to be doing neural imaging as well as cognitive interviewing and diagnostic interviewing over the years, but it's in the first couple years of the study. So again, we've kind of got a long way to go in terms of those longitudinal studies, because we would have to start so early and follow their trajectory for a while, given the timing of when cannabis use happens, when mental health issues occur. So James says, is cannabis linked to schizophrenia? So great question. That's probably where our strongest evidence is right now. So we have really consistent evidence that cannabis use typically comes before the development of psychosis or psychotic disorders like schizophrenia, and especially if individuals have particular genetic risk factors. Cannabis is definitely linked to either an earlier onset of schizophrenia or earlier onset of psychotic disorders, and a greater likelihood of developing. Now, we still again have that question of, are people who are going to develop schizophrenia or psychotic disorders more vulnerable to using cannabis in the first place? So they're just kind of related to the same things, but there is fairly strong evidence suggesting that cannabis use at least kind of makes it so that individuals experience these problems earlier on in life, which can make it potentially more difficult to treat in a more severe disorder. Yeah. Okay, so Mary says, how does the use of recreational cannabis use now compare to the 1980s in terms of mental health issues? Yeah, so cannabis use, like any substance, we kind of have ups and downs of substance use over the years. So there's a study called the Ontario Student Drug Use and Health Survey that's been following kids' substance use since, I believe, the 70s, but it's been for a while now. So you can follow it and you can look at the ups and downs over time. With adolescents, we actually recently had a bit of a decline in the prevalence of cannabis use, but potentially an increase recently. But yeah, so we potentially might have had a recent decrease in that use, but we've potentially may have had an increase in the total Canadian population use over time, as there are also Canadian studies following it over time. But we haven't really looked at these associations and how they've evolved over time in terms of mental health issues. However, we did do a study using Statistics Canada data from the Canadian Community Health Survey from 2002 and 2012, where we looked at the association between using cannabis at least once a month and the likelihood of experiencing major depressive episode or psychological distress or suicidal ideation. And we did find that that cannabis use and these internalizing problems were co-occurring more so in 2012 than 2002. Now, these weren't the same people surveyed at each time points, but they were representative samples at each time points. So we did see a stronger association. Now, that could be that more people today are using cannabis to cope with mental health concerns than they were before, or it could be that a higher potency of products are linked to it. We don't necessarily know why it might be co-occurring more so today than it did before. Mm-hmm. So Joan says, is there evidence that cannabis acts as a gateway drug? So for any of you that have heard of the gateway hypothesis, this is kind of like the sequencing of substance use, where an individual starts with kind of softer drug use, so like alcohol, tobacco, cannabis, and then illicit drugs or harder drugs, and that there's this sequencing of events. So alcohol kind of primes you or makes you more likely to use tobacco, which makes you more likely to use cannabis, which makes you more likely to use other drugs. This is a very, very controversial hypothesis that's been consistently heavily debated over the years, and there's really there isn't strong support for that gateway hypothesis, although there is kind of that biological component, where is it that these drugs are priming the brain to make you more likely to use other drugs, or is it kind of a level of risk as you start with your more socially acceptable drugs or legal drugs and then go into harder drugs? So that's where the hypothesis comes from, but it's very, very debated, and there's evidence for and against both sides of that. Mm-hmm. Okay, so an anonymous attendee said, are there any studies regarding cognitive behavioral therapy and use reduction in adolescents and or adults? Yes. So that's where the best available evidence is right now for treating cannabis use and cannabis use related problems is the use of cognitive behavioral therapy. And this has been done in both adolescents and adults. We just don't have a lot of it. We also don't have a lot of those populations that have both cannabis use and a mental health condition. So that is where the best available evidence is right now, and we could and should do better. Mm-hmm. Okay, so we're gonna do one more. All right, so let's see where we're gonna go. So we'll do, does smoking cannabis have any impact on the rest of the community and why? So this is, again, this is a tough question. There is some research on secondhand cannabis use, so kind of like secondhand smoke. What's the impact of secondhand cannabis use? However, I think that this is more potentially kind of a social phenomenon, and we do have this increasing social acceptability and decreased perceptions of risk over time. So it might not necessarily be impacting the community as much, but that's, again, I don't necessarily know the exact answer to that. And I think it's very complicated in terms of social processes and perceptions of self and others and such. Yeah. All right. So that's all the time we have for this evening. Thank you so much for joining us. This presentation was recorded, and we'll send you a link once it's up online. Thank you once again, and enjoy the rest of your evening.
Unstructured research.